Pseudomonas bacteria cause infections in hospital patients. A new strain of Pseudomonas bacteria has evolved. This new strain can only be killed by one antibiotic called fluoroquinolone. Scientists want to prevent the new strain of Pseudomonas from spreading in the human population. Explain the advice doctors should be given to prevent the spread of the new strain. And this is worth a total of 6 marks. Because it's an explain question, effectively what we're going to have to do is we're going to describe something. So six bullets. Describe something and then say why that matters. Okay, so it's a describe plus explains, just describe plus questions. So first thing we might look at is how should they treat people who have this when they first come in. So doctors, we've obviously recently lived through a pandemic in this country, so we understand probably a little bit better than we used to about what doctors might do. So doctors should isolate patients with this bacteria. Okay, so first thing, well, why is that? This will reduce the spread to other people. Okay, so we can do that. We might say that doctors should sterilize between every patient. Doctors should sterilize. So sterilize and clean between patients. And they do this. I'm going to keep this in the same sentence, to kill any bacteria that may spread. Okay, what else should they do? Well, they need to, we've got this one type of antibiotic, so only use fluoro, because what we don't want is any bacteria becoming resistant to this. Only use fluoroquine alone on patients with this bacteria. Okay, also ensure that they finish their dose. Also make sure patient finishes their course. Okay, so finishing the course on antibiotics is really important, because you might feel better, but even if there's one of those bacteria left in your body, which isn't enough to cause any symptoms, as soon as you stop taking the antibiotic, they will just increase in numbers again. So only use fluoroquine on patients with this bacteria, and also make sure patient finishes courses. Well, why is that? This will reduce chances of bacteria becoming resistant to this antibiotic. Because if we've only got one antibiotic that works, we really want it to keep working, don't we? Okay, so what else do we make sure? We might add a bit of information here, possibly about reduced chances of becoming resistant to this antibiotic. I'm trying to think what else we might say. So make sure of this patients with this bacteria. Let's make sure patient finished course. So I've sort of got two things in here. This reduced chance of bacteria becoming resistant to this antibiotic. I think what we might say is finishing course of antibiotics, biotics will ensure all bacteria in patient are dead. Are killed. Okay, there's quite a few things you could do there to get all those marks. The key bit is you're going to describe something the doctor should do and try and say why you think they should do that.